Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Let's get you the data first. In India has reported 45,892 new cases in the last 24 hours, 817 deaths in that same period. Now, the active caseload is currently 4,60,704. Active cases constitute 1.50% of the total cases. But what remains a big worry is the vaccination drive. India has vaccinated a total of 36.5 crore people with at least a single dose of the vaccine. But the current rates are a huge worry. On Wednesday, India administered 33.8 lakh vaccine doses, while we should be vaccinating over 86 lakh people a day to inoculate 60% of the population by December, as promised by the government. In fact, states like Delhi and Tamil Nadu reporting a shortage of vaccines. Now, the focus on the show today, a new coronavirus variant. Yes, there's another one. Lambda has emerged, and scientists and experts see the latest variant of the virus that causes COVID as a fresh threat to the gains that have been made over the last year or so. The World Health Organization declared Lambda as a variant of interest on the 14th of June. However, according to WHO, the first case of this variant, which was earlier called C.37, was reported in December 2020, and 6 cases of the Lambda variant have been reported in the United Kingdom. To talk more about this, let's go across to Dr. Malur Sudhanva, consultant virologist, South London specialist, King's College Hospital. He's joining us from London. And we also have Dr. Rajesh Malhotra, Chief COVID Facility, Trauma Center, AIMS, joining us. Thank you so much, doctors, for joining us on the program. And first to you, Dr. Sudhanva, if you could tell us, what do we know currently about this new variant?
Well, this is good afternoon. Thanks for having me over. This is a variant which emerged, as you mentioned, sometime in December. It was mistaken earlier in the part of the year as supposed to be the Brazilian variant or the Gamma variant, especially in Peru. But the problem in Peru was they didn't have the facilities for sequencing. Once they sequenced, they found that this to be a distinct subset within the Alpha variant, B1117. And they found this one has 7 different mutations, 6 of them in the spike. And that's how they labeled this as a completely different variant. Just do remember, this is still a variant under investigation. That means we still do not know everything about it. We have to do the risk assessment based on all the clinical facts, the morbidity, the mortality, how it spreads, how it transmits. And then it will be, if it's found to be dangerous, then it will become VOC or virus.
Because there's already been a bit of, sensational coverage of this variant, with people saying, it escapes the vaccines. On the other hand, in Chile, we know that they were using the Chinese vaccine, so that has its own concerns. Also, whether it causes more severe disease. Already there's some headlines screaming that it's more deadly than the Delta variant. So what do we know so far?
We should take a calm approach on this.
Sure.
The virus it's not spread throughout the world. Yes, there have been cases around the world, but there are smattering of cases. In UK, for example, there have just been 8 cases. Last week it was 6. You rightly reported that. 8 cases as of yesterday. It has not replaced the Delta variant, which is by far the most transmissible one. Next, we do not know whether it causes more disease in Peru, because all the sequences in Peru, for example, have not been done. We know that 82% of the cases in Peru was because of this. Whether this is actually the reason for all the morbidity and mortality that's happened in Peru, which is quite high percentage-wise, we do not know that yet. And that's where the risk assessment and data will come in. Next is the vaccine. There's good news on that. There's recently been a study on 3rd of July, which has been published, not yet peer-reviewed, where they clearly showed that the antibody response is as good as anything for the Lambda variant. So that's not the case. So I don't know much about the Chinese vaccines that you mentioned. Of course, there have been Chinese vaccines, countries which have used them, they have had problems in spite of the vaccination. So in fact, they're ignoring whatever, especially the Sinovac vaccine. And that's just one of the many Chinese vaccines. I do not have that on all of them. I hope that answers your question.
Right, because there's a study in Chile which talks about immune escape from neutralizing antibodies triggered by the CoronaVac or the Sinovac vaccine. So that's the only study we currently have. And currently here in India, we don't have this variant, thankfully, Dr. Rajesh Malhotra. But this is something we have to continue watching very closely as these new variants are emerging in different parts of the world in over 20 countries already.
That's absolutely correct, Gagi.
Right. So here in India, if we've seen the Delta variant and the kind of havoc that it's caused. Now we all are also increasing our genomic sequencing of various tests that are taking place, so that we know that if any other variants emerge, and with this other variant, and we still don't know whether the Lambda is going to be deadlier, but we still have to be on our guard. So if you could talk a bit about, the current situation in India and the fact that we are trying to ramp up the genomic sequencing.
Yeah, so you're absolutely right, Gagi. The genomic surveillance is the best tool which we have in order to identify the emergence of new variants. And that has to be done when there are clusters or outbreaks and you want to catch them early if it is being caused by a new variant. And the concern is because, it was said that the Delta has 3 mutations in the spike protein, the Lambda has 7. And we know that the spike protein is the area through which the virus attaches to the cell. And all our vaccines are target this spike protein. So we are always worried that whether these mutations in the spike protein will lead to the vaccine being rendered less effective. The same thing holds true about antibody treatment. So I think we have to be on the, but let me tell you one thing which is very interesting.
Sure.
The entire living form on the earth is the survival of the fittest, right? So every time the virus which causes a wave is when it has come out in a more fitter state to survive. So you will not have a big peak caused by 2 variants. So the Delta is smart. So if the Delta is, so the first wave was caused by D614G, which was far more transmissible than the Wuhan virus. Now this one, the Delta was more transmissible than the D614G. So unless the new variants are smarter than Delta, I'm sure that the Delta will not get easily displaced, and that's something which is a good news for our vaccines, which still seem to be effective against that, and our own immunity, which seems to be effective.
All right, Dr. Sudhanva, now this news of this new variant and some cases being found in the UK come at a time when England is poised to actually lower all guard against coronavirus and lift all restrictions, something that is slightly controversial there. So what does this mean now for those plans of the government?
Well, let me divide my answer into for and against. Hopefully that will help you. So the vaccine coverage amongst adults in UK is about 86%, but the children, if you take the whole population, it's about 51%. The children are not yet vaccinated. There's an increased number of cases now, dramatic increase, yes, but there's a dissociation between that and the number of hospitalization and the deaths. Remember, the number of cases started increasing a month ago. We're still not seeing a huge spike in number of hospitalizations and deaths. It's still at the level which was like last September, October, around that level of October 6th to be precise. That's how the level is as of yesterday. So then you have if not now in the summer, when do we have to open up? So that's where the government is struggling with that, opening the economy and enjoying the summer. And of course you have the Euro 2020 and the people want to enjoy the feeling of what's happening on the field there. And within the NHS, there's a backlog of elective cases, which a lot of people are suffering because those people have to come into the hospital for various treatments, be it acute or long-term. Then we have the best capacity for surge testing and sequencing, proportionate to number of cases that can happen. So those are all the for. The against is, if we lift the restrictions, especially the indoor mask, that would be a terrible thing. Israel, which is a highly vaccinated country, lifted all the mask restrictions, but it took only 12 days for them to impose it again because of the surge of cases. There was a disco in
Right.
Netherlands where they experimented on 660 people going in without masks, and they faked their testing thing. Some of them were not vaccinated. They went in, 180 of them as of yesterday were infected. So without the mask, that mask is the thing that worries me. We got to have the mask regardless of whatever has happened, so that prevents the transmission. And we have enough evidence that masks work. I hope that answers your question.
No, absolutely. And WHO, in fact, the chief Tedros has just said that he's warned against countries that are well vaccinated just lifting all restrictions, saying we have to continue to, take care. Dr. Rajesh, if we talk about, the reason that that England is confident about lifting restrictions currently is because of their rates of vaccination, and at least over 80% of the population, adult population, has received one dose of the vaccine. But here in India, the vaccination drive is a big worry right now. We did have, one day reaching record number of vaccinations, but currently, if we take a look at the numbers, they're very worrying. Yesterday, we vaccinated, 33.8 lakh people, whereas we should be vaccinating over 85 lakh every single day.
Yeah, you are absolutely right. So I think the number of vaccinations have to be ramped up, and I think the vaccine hesitancy has to go. But at the same time, I think another reason which is interfering with the rate is the availability of data for the vaccine for the children. And once we have that, that should help. And second thing is a large number of people are not able to take their first or second dose because they were recently during the second wave infected by the COVID. And as per the regulations, they now have to wait for 3 months before they can get their first or the second dose, which would have been due otherwise. So you are absolutely on the spot. We need to ramp up the numbers. That is our only defense apart from COVID appropriate behavior, and the people have to come forward. In fact, Joe Biden on the Independence Day said that getting vaccinated is an act of patriotism. And why only for US? It is for everywhere. You are not getting vaccinated for yourself. You have to get vaccinated for your entire country, not even if not even for the whole world, because this disease is going to travel all around the world. Everybody has to be protected.
Right, and we're going to see new variants emerging if we don't manage to stop the spread, and that remains a big concern. Though in India, I think currently it's the shortage of vaccines that's leading to this low rate of vaccinations per day. Thank you so much, doctors, for joining us on the program to talk about this new variant and, of course, various ways of us ending this pandemic. Thank you.
Thank you.
Well, talking about a new normal and countries living with it, Singapore is now preparing a strategy to live with coronavirus, treating it like a flu. Soon, residents will be free to work, travel and shop without being subjected to quarantines or lockdowns, even if the virus is around. In fact, according to three co-chairmen of the government's task force, it's an interministerial task force on coronavirus. According to them, the plans for Singapore is to adopt a new normal. COVID will be treated like any other endemic diseases such as common flu. The ministers also noted that if supplies allow, the government's next goal will be to have at least 2/3 of the population fully vaccinated with 2 doses by National Day. That's on the 9th of August, and then they will start lifting all these measures, all these restrictions that have been in place. Well, to talk more about this, we're joined by Professor Dale Fisher, Senior Consultant, Infectious Diseases, National University, Singapore Hospital. Thank you so much for joining us on the program. If you could tell us about this new strategy that Singapore is planning to adopt, hopefully after August.
I think every country will have to establish a strategy for transitioning, especially as you get more vaccinated. You see, for the last year and a half now, everyone has been doing everything possible to prevent transmission, whether it's lockdowns or mask wearing or no travelling. So now we have to work out, as we get more vaccinated, how can we ease some of those restrictions? Because obviously, there's restrictions now, and in the future state, then the vast majority of those restrictions will be gone. So it's really about how you lift the travel and the social restrictions and rely on vaccination and the public health system of quarantining and contact tracing and testing and all these types of things. We want to rely on vaccination and the public health system and start easing those travel and social restrictions, which are so harmful both socially and economically.
Right. So what would living with the virus really be like? What would this entail? And this comes at a time when we're seeing variants emerging in other parts of Asia.
Well, the vast majority of Singaporeans have been very loyal to the cause. They've really stuck by the measures because they appreciated the importance of the community in fighting transmission. So actually, in Singapore, people are desperate to get on a plane and travel and go and have a holiday, see loved ones overseas. They're very keen on getting back to mass gatherings. Up until recently, you could only have 2 people visiting your home at a time, and that's about to go back up to 5. So we're really looking forward to all these measures coming off. Of course, some people are a little bit wary, but you know, we've been waiting for so long for the vaccine to lead us out of this pandemic, and we have to trust the science and step by step let the vaccine lead us out of this pandemic.
Right. So, Professor Fisher, if you could share with us, what is the situation in Singapore like in terms of infections currently? I know the numbers are nothing like, of course, here in India, but even so, what is it like currently?
Yeah, well, we did have some recent introductions of the Delta variant. I don't really feel comfortable telling you our numbers when I'm speaking to India, but our numbers are very low. We're single digits in the country now. I think just 2, 3, 5 cases in the last few days. This is a country of 5.8 million. So at our peak, we got up to 30 cases a day over the last month, and that was across 48 clusters. Though most of those clusters have closed off now. We're now down to about 20 active cases, active clusters. Sorry. So we have good control. So really, it's about removing the restrictions and relying more on the vaccines, and that's what the strategy is all about.
All right, relying on the science, relying on the vaccines. You've been vaccinating children as well, and what has that experience been like, and how much have you managed to cover in terms of vaccinating children?
Yeah, we started doing that a couple of weeks ago. I'm not sure of the numbers, but it's around 60%, I believe, have now had their first jab. They'll be coming up for their second jabs over the next month. There's good uptake. There's popularity with it for many reasons. People want to be protected against COVID, but they also want to see the restrictions left. We've unfortunately had, I think, 12 cases of myocarditis and pericarditis, and this has been seen internationally as well across the world with the mRNA vaccines. So we recently had someone with a cardiac arrest, a teenager, after he was doing strenuous exercise. So what we've now put out in the guideline is that once a young, particularly a young male, has had an mRNA vaccine, then they really shouldn't do any strenuous exercise for the next week. All these inflammations are self-limiting. They go away after a few days, but obviously if there's unrecognized inflammation and strenuous exercise, then that can cause cardiac troubles. So we're being very transparent and sharing information publicly, and I think that's helping public confidence.
All right, well, thank you so much, Professor Fisher, for joining us on the show, and it will be very interesting to watch Singapore's example going forward. Well, with that, time for us to slip into a short break. On the other side, your questions on coronavirus, vaccines and antibodies, and we'll have Dr. Rajesh Malhotra to answer all those questions. Now for our campaign, Vaccinate India, in partnership with Google, where we discuss questions that many of you look up online, questions that you often Google about vaccines, about coronavirus. And to answer those questions, we have with us Dr. Rajesh Malhotra, Chief COVID Facility, Trauma Center, AIIMS. Thank you so much for joining us on this segment. And one of the questions that people have now really started looking up is whether the presence of antibodies means that the person is COVID immune, since many of us have had the infection, many of us have had the one dose of the vaccine. So what would your answer be to that?
So the presence of antibodies does mean to a great extent that there is a possibility that you could have been exposed to the COVID, though it's not a 100% accurate thing, but it definitely does not prove that you are protected, because you know that the protecting antibodies are not the ones which are detected routinely by these tests which are being referred to here. They are very complicated tests which are done in the lab. So the neutralizing antibodies are the ones which tell you that you are protected. So the CDC has actually told people to dissuade from either asking for a booster dose because they didn't have antibodies after their 2 doses in their blood, or avoiding vaccination because they had antibodies in their blood. So it is not something which can help you decide about whether to take a vaccine or not, or whether you are protected or not. They just mean that maybe you have been exposed to the COVID virus, but it doesn't tell you that you are protected against it. So regardless of the antibody status, you have to get your vaccines. And if you have got both the doses, regardless of whether what level of antibodies you have, you are still protected.
Right. In fact, I was going to say there's the reverse question as well. If you have 0 antibodies, if I have friends who've got themselves tested after having had the infection or after the vaccine, and they have 0 and they get very anxious about that. So what would you reply to them?
So that's what I said. 2 things they must remember. One, that the vaccination causes not only antibodies but also the T cell protection, and the T cell protection also fights the infection. So there's no reason to despair. And secondly, even having 0 antibodies detected on that test does not make you a candidate for asking for a booster dose or a 3rd dose, because that does not prove that you're not vaccinated. We see all kinds of myths. Many people feel that if they did not get fever and body aches after vaccine, it means the vaccine possibly is not working in their body, which is very different.
That's a common fallacy, yes.
If you get flu, not everybody gets high-grade fever, not everybody gets simpler. The human body is so complex and so diverse, everybody's response is different. So not to worry about it, the efficacy is all tested, and do not put too much of money or reliance on the antibodies.
All right, and stop comparing your antibody levels, which is another thing people have started doing. Another question that people often look up is, especially now that Moderna has been approved, how do mRNA vaccines work?
So mRNA vaccines work in a way that they are still targeting the spike protein. So what it does is it goes inside your body and it makes your body cells produce the spike protein. Now that spike protein is identified as an enemy by the body defense, and it starts attacking like the antibodies which are produced in response to the normal infection, with the result that you are having a fire mock drill where you don't have the real enemy, but you are marshalling up all your resources to respond to that challenge. So that's what it does, and the mRNA which is put in gets disintegrated and disappears from the body. The best thing about mRNA is that once we have vaccinated everybody, there are a lot of studies which show that those people who have had vaccination, particularly with Covishield, the mRNA may eventually work to be a very good booster sort of vaccine to give a wider coverage. So we'll wait and see for more data about that. But it's going to be a very useful addition. Particularly it has been tested for the younger people also, between 12 and 16, pregnant ladies. So all those things are going to make it a very useful tool in our armamentarium.
All right. So, we're waiting for the Moderna vaccine also to come to India, and you're saying that the vaccine cocktails going forward will be something very useful. And of course, we do know that they have been approved for children as well. Thank you so much, Dr. Rajesh, for joining us on the show.
Thank you.